Hello, everybody. My name is Jeremy Shabo, and I'm a veterinary student at the Ontario Veterinary College, and I'm here today with Melinda Crowley, who's a 2013 grad of the Ontario Veterinary College, and currently an intern at Virginia Equine Imaging. Welcome.
Thank you.
I thought we could just kind of start off, and you could talk a little bit about, give a brief overview of the internship. You're talking about how many interns there are, if you do have any rotations, emergency work, stuff like that.
Yeah, for sure. Virginia Equine Imaging, or VEI, is a lameness-only clinic, and there are three primary veterinarians, one of who owns the clinic, and then he has two associates, and then he takes on two interns most years. So this year, there's myself and another girl as the interns, and so we don't do any emergency. We do some ambulatory, but it's mostly in clinic work. Like, our main job as interns is to help Dr. Allen with his appointments, and then the other associates as necessary. And sometimes we'll do out calls to farms, mostly for shock waves or radiographs or things like that, but mostly in clinic.
And do you guys live on site or off-site?
No, we don't. We live off-site. There's on-site rooms for externs, but as interns, we live off-site.
And are all the patients outpatient appointments, or do you have?
They are. We don't have a hospital per se. We'll keep horses overnight if we're doing bone scans, because then they're radioactive, obviously. And otherwise, sometimes people will drop off their horses if their appointment's the next day and they've driven up, because sometimes they come up from like South Carolina or North Carolina, and so they'll come up the night before, drop off their horses. But we don't have any hospitalized patients.
So there's no emergency work, no on-call at all?
Correct.
That's pretty cool.
It's a pretty sweet deal. Like, I guess I am 5 months into my internship, and I've had to work 2 weekends. One, we worked at a horse trial, which was a pretty good deal. It pretty much involved sitting in the truck and watching horses go cross-country. And then the other weekend, we hosted a conference, so we were part of that.
And how would you describe the amount of supervision you've seen kind of from the beginning to where you're at now?
We get fairly consistent supervision. At first, kind of especially since we're mostly in the clinic, there's a vet there pretty much all the time if we need an assistance or anything like that. Things that they've seen us done, they trust us to do, and they don't really micromanage. I mean, if they've seen us do like a low 4-point block, they're not going to stand over us every time we do it. But at first, they wanted to make sure we were comfortable with everything that we're expected to do.
Yeah, and how would you describe the hands-on? Is it pretty? Do you get a lot of opportunities to practice things, or is it more hands-off?
At first, not quite as much. They started us into like the basic blocks right away for the appointments, and then we're slowly, gradually getting into more and more of it. I think because a lot of our clients are fairly high-end and the horses are high-end, it kind of limits what we're able to do as interns, but we started to get to do more, and especially with the bone scan horses, since we have them to work up the next day, they let us do more with them, and yeah, so we're getting a lot more hands-on with the ultrasounds and things. Well, from day one, we were taking the radiographs ourselves, and as the time goes on, we're doing more and more ultrasounding, and we'll scan them before Dr. Allen does and things like that. So,
yeah. And what would you say has been the biggest challenge so far?
Calling myself doctor to clients.
Yeah.
I find that's really, really awkward. But no, and just, I mean, I've moved to a different country and things like that, so just kind of getting used to being down here and getting used to it. But as far as the internship goes, I think that we're really well supported.
Yeah. And it sounds like your internship is unique when compared to other ones, because most of the internships are rotating and they do ambulatory and they do a lot of other stuff, and you guys are just focused on lameness.
Yeah, exactly.
What advice would you give to students who are kind of either unsure about doing an internship or unsure if they want to do a specific lameness internship or rotating internship? What would you say?
I'd say if you're unsure about doing an internship in a specific area, then do a more general one. or if you think you may want to do a residency in internal med or in surgery or whatever, then don't do a specific lameness internship like I am. But then on the other hand, I think that a lot of regular practitioners are maybe not as used to doing the lameness stuff that we do, and I think it's a good basis, because I think lameness is something that's hard to get a grasp on, and if you have a good start on it, then that'll make you valuable.
Yeah. What has been your best experience so far?
That's an excellent question. I think working the horse trials was a pretty good experience for sure. It was just the other intern and I. We had a veterinarian from another clinic who was also on the grounds, but we didn't have anyone from our clinic. So I think just being released to go do our thing was a pretty good deal.
Yeah. Cool. Well, do you have any final thoughts for students watching this, or maybe thinking about doing an externship or internship?
I mean, I'd say just visit as many places as you can. Like fourth year gives, and in summers before fourth year, you have a great opportunity to, even if you aren't thinking about an internship, just to see the way different clinics work, and you can take a little bit away from all of them.
Yeah.
That's fine.
Cool.
I was just going to say, if you're thinking about doing a specific internship, then I think you should go for it, and you'll enjoy what you're doing.
Did you always know you wanted to do a specific internship like that?
Yeah, I think so. I worked before at Mohawk Racetrack, where they did just lameness there, and I fell in love with it.
Yeah. Cool. Yeah. Well, thanks, Mel, for chatting with me tonight, and thanks for everyone who's watching. If you guys have any questions or want to check out more videos, be sure to check out my blog, and we'll talk to you later.